Paul Amo Kyeremeh, on a director of Ghana Adventist Health Services, that of the northern part. I would see free the whole Ghana Nina, and until you say the you buy your house, bozu chain, bozu fantastic, and I don't know, or your shuffle. Yes, I a doctor paying pa away. Now, okay, I'm maybe crop about Tamale, and ye be yen church, 1 week in church, come, I always say maybe be a coso, my neighbor Bobby we know. You best a serious and ever sign back. Na at least 15 minutes scribe, a bonus night chimsa. And the pastor I will fear her say, Timekon, Honamine pastor, you can call base Madunum. Na ye bishop, ya mo pastor Quaba, saying, can pay dear, can him say be a pastor Bana. When you have a change and coupon assem. Now, in the midst of COVID-19, or background into me rush on them. You got to do with the original one to know a chairman base because you have more than 25. I am better with pastor. Pastor, Aqua,
yeah,
but you feel recorded.
Yami Adam.
Nano paid ye a happy Sabbath. So,
Yeah, happy Sabbath.
I no paid them patcho, then it will be do Tamale Crew.
Oh, where the body be in him? Maybe T4, you know, good morning. Then Chia Strong from Ghana Adventist Health Services, the Secretariat.
Okay.
To all our listeners and our friends and our sympathizers.
Yes.
And up idea, body be in him, Onyame Adom. Me ba se me ba be hwese na mo hosetie.
Okay.
Na ya be hwe Tamale a hospital so near ma ekoso. For COVID-19 ho na yehu manamo ebitimi atu ne mo a ahodo a ebitimi de aboa amanema atoto ye e de amaye. Yeah, nti we de ayasombe.
E de nyame asese nyankopon so de bedu ha asombe. Na asa we de we bedu e de say de omampanyi na kasa ye ne experts na eni nkomo in terms of COVID no. Nti be bisa o say COVID no say baby ye duru den say ye asankurankure.
Oh, okay. COVID-19 no, it is true. Yare no ewo ho. Bimo say homo yare. It is never true.
Okay.
This morning, the news I got from the US indicated more than 50,000 people in the US alone.
Yes.
And globally, omo wu so edoso pa. Edinti yare no ewo ho. Now, preventive measures are World Health Organization at the MIA. Ghana Health Service at the MIA, our Ministry of Health at the MIA,
Okay.
and other bodies at the MIA, including my secretariat. And so we came out with a statement. Directives here, we should comply. Yemfa enye juma yediso. Na yediso na yedi juma ebitimi aboaye. Number one, say social distancing there ebitimi aboaye. Only nipa ewa mamo mai so mamo ntem ente kakra. Beyond this, and so frequent hand washing. Yehoro yensa under the running water. Infansu semina enye yensa nehoro yensa at least. They said not less than 20 seconds or even more. Some are saying 20 and others are also saying 40. Yeah, then to be on the safer side, then opt for the 40.
40 yes.
Okay. Yes. We are not saying that the 20 is not true. Okay. And into no na into the MYA. And seminar no eka aboana yewreyansa aboana ufri wonsa.
Okay.
And into na yemfanya adwuma. And afin so no wearing of a mask. Face mask. It is very, 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 very important. We shouldn't downplay with this. And before the president came out with a statement that it is a must that we put on this mask, face mask. About a month ago, I shared this on my Facebook wall that say per se flattened. Disease, spreading.
Okay.
Obibia momode say obetimi I put you on mask.
Okay.
Now obia put you on mask. Now the other preventive measures no edi adwuma. Within a month to two, we'll flatten it.
Okay.
Ama atimi abafam ama atimi aboye. So it is very, very, very important for us to do so. And with this no, yes sir, ebetimi aboye.
Okay. That's the nyamiase so I made the inside of it BBI. Pastor, you're back to your health, Is the hospital. All along from all the way from headquarters, back down. Obedru ye no, ne na wo pese wo hu no, ene wo hu. Ana say yenye bi nka ho mo be na pese omo mutie so obi obetimi e dey abo hospital no.
Thank you very much. With the COVID-19, we were informed, say your hospital in your 2 suspected cases. Pastor, is that correct? Yes, 2 suspected cases, no. But if we take a sample, results no better back on positive. Okay, and you omo call isolated center abino ayidi amayo Tamale ha ye treat ni pano ewo ho. And when we heard of this, now quickly we have to rush down to come and strengthen our people with logistics, so that at least they'll be able to take care of the people of Tamale and beyond, without considering the risk and those staff, and also to strengthen them. And that's the reason why I quickly rushed here. When I was informed, quickly I have to put few things together and then rush here to make some presentation to them, and then I return to my office to continue with the work and also to strengthen the people. And the fact remains that the hospital, as the hospital in Tamale, they are doing very well. They are doing extremely well. I have confidence in the management. I have confidence in my doctors. I have confidence in the workers, and I have confidence in the community at large. Okay. Because when they come for board meetings, even the community rev, and those stuff, how they contribute, it is great. Okay. The assemblyman and those people, how they contribute. You see, they are doing the work with passion, with zeal. Okay. So Tamale, our hospital is doing very, 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 very well. And as Shark institution, we don't go on strike.
Okay.
Obiako striker, strike. We have to be there to work to save the people. Okay, and that is what we are in for. And like when government hospitals are on strike, we have to be there to save the people. And the Tamale, it has happened over and over and over again. Government hospitals are on strike. Our people should be in to save the people. Okay. So as a mission hospital, as a Christian institution, we don't go on strike. So we are here to save the people, and we are ready to serve and to save them.
Okay. And the pastor is here to make sure say Obia or Tamale biano service even say ya no kra kanwa ye wa kadia ye betimi e dia so ano na ban so ayede aboasa. Now pastor with the same hospital we say when you be one is isolation, the other one also because it's negative niti. What say I can say situation pa ewo SD hospital at the same.
What do you mean by SD? We mean Tamale or Ghana?
No, Ghana as a whole SD hospital.
Yes, thank you very much. It is a brilliant question. As a network, you are running by your facilities in Akasa. You put 2 measures in place. We've invested a lot. Okay. The facilities have invested a lot in logistics, IBTME, and their support. It is not enough. It is not enough because, for instance, like Coverall, some places there about 600, 700, maybe you cross 800 Ghana cities. So even it's a 100,000 Ghana cities here. Are you getting the point? And then most of the cases now about the COVID-19, obi natural personal symptoms and daddy. And it has become also a problem for our workers. We should get enough logistics to protect our workers, okay, so that they'll be able to take good care of the people without exposing them to the risk. Yeah, and with the SDA preparation, facility levels we've invested a lot, yet it is not enough. Let's take this for instance: face mask, surgical mask. Boy, Canada is about maybe 20 cities or 25 Ghana cities per box. 50. But then some places it is 350 Ghana cities per box.
This morning I was listening to director of health, Ghana Health Survey, and was making the same assertion. Say
fantastic.
Say it used to be. He said that the whole box was 30 cities.
Yes.
But now the last time he checked, there's a 350 Ghana.
Fantastic. And this morning, we managed to bring about 30 boxes to Tamale SDA Hospital.
Oh, okay. Praise the Lord.
30 boxes.
Yes.
So 300 times 350 times 30. It is more than one.
The workers who were lamenting and complaining at the hospital that they don't have most PPEs and those things. For the, Pastor has assured us that this morning, after the handing over, by tomorrow, if you pass there to do a cross check on them, you will see them wearing it.
Yes, so meaning that I brought them 1,500 pieces.
Wow, 1,500 pieces.
Okay, yes. So previously, this 1,500 pieces should be less than maybe 1,000 cities or two.
Yes.
But now it is even more than 10,000 Ghana cities.
It will be more than
okay,
that.
so it is a problem, meaning that all of us, not only the government, but corporate bodies. We are expecting the banks, we are expecting other institutions. They should help us, not only as the hospitals, but the hospitals around, so that collectively, all of us together, we will be able to save the people, and then we get the needed logistics. So I'm encouraging the banks, I'm encouraging the corporate bodies and other institutions, and even individuals who are willing, who are attached to support, so that at least we'll be able. Because when I heard that Tamale is a risk area whereby we've been able to confirm some cases, and in our hospitals we've also started experiencing some of these things, quickly we have to come down with some PPEs to help them.
Before Mema last week na ya corner, because what bad no say busy schedule, so no it doesn't but me call the director of the facility Nankasa ya kan say what Tamale say no. Pastor Muzu is here with us this morning. Pastor, good morning.
Good morning, sir.
And happy Sabbath.
Happy day.
Pastor, director is here for the whole health service of SDA, and then you supposed to be our nearest neighbor. Because if you happen, you are in Tamale here. Pastor have confirmed one, that's the case that we are talking about. How was the situation like when the case came? It was positive. How did they take it at the hospital?
Thank you very much for the question. We must first of all applaud the professionalism of the staff at SDA Hospital Tamale. They suspected the case, and quickly they link up with the regional team, and they came and took the samples. And when the sample was sent for testing, it came out positive. So it means that the professionalism of this staff who have been able to identify that this is a suspect case, and the result has confirmed that what they suspected has been confirmed. Then it shows that the system put in place at SDA Hospital is actually working.
Robust system.
Had it not been that, the patients would have walked in, had contact with many people in the hospital throughout the record, maybe finance, laboratory, consulting, all those places. And then you know what happened in that situation. It means that so many people will be in contact with the virus. But due to the mechanism we have put in place, our system has worked for us. And as the news came that the result is positive, our staff, they are still calm, working tirelessly to contain the situation and help save lives.
So Pastor, with this session of this, the last time I passed it, my last I came to this, social distancing was not the best at SDA Hospital, which I published on my that one, we don't do this. So for this issue of, when I heard it, I passed by there to check if it's the same. But I don't know, is it the facility or the individual who don't want to take their own life into their own hands by taking care of themselves? Because you might be in your office, you don't even know what is going down there, especially outside the hospital. So what measures are you putting in place now? Now we know that Tamale is now a prone, because now the number increases every day. And I don't want to give the number that came last night, because we are yet for the experts to give the number, then we do the same. I know the number of Tamale today.
But you don't have the authority to declare.
That's what I'm
Fantastic.
saying. That's what I decided not to. In the morning up to, I have not mentioned any number. I'm waiting for the authority to come out. If they mention, then We will now run commentary over that. I don't have. But now the cases are increasing day by day. What assurance can you give to us as patients who are coming to SD hospital? That if you come there, because I've seen a country where in the hospital they have this demarcation, a square box, and there's a chair there. Either you want, if the number is the rest of you go home. I don't know. What assurance can you give to us?
Thank you very much. In this health crisis,
Yes,
we need the understanding and the cooperation of everybody.
Okay.
As institution, SDA Hospital Tamale has put everything in place.
Yeah.
What do we mean by everything? We have put a pre-triaging system to screen everybody who entered into our hospital.
Yeah.
Of course, the hand washing materials are there. And when you come, we have put canopies outside.
Yeah.
And we have put also there chairs observing the social distancing. Of course. Then we use our infrared thermometers to avoid direct contact with clients.
Okay.
And when you are given access to the facility, you come to our OPD, you see that everything has changed from head to toe.
Okay.
The pews that used to be there are no more there. We have put there plastic chairs. We have invested money for the safety of our staff and safety of our clients. It's unfortunate what you have just mentioned.
Yeah, this is the picture I'm talking about.
And I've been shown it on Facebook.
Yes.
But our emergency team comes frequently to call our clients to order. It's like when they are given access, they want to rush. Let me be humble by saying that technically, if you observe Tamale, you see that the number of hospitals that we have in this season of COVID-19, it has reduced. I won't mention any.
Oh no, that one
is
not in doubt.
So
because some of them, even if you go, they will ask you to go back.
When people
some of the cases like normal, maybe severe headache, those ones which doesn't, they will ask you for now. Their focus is on. But if you go to SD hospital, yes, you'll be attended to that one. Nobody.
We have put a robust system in place. They will talk about a holding center.
Yeah.
If anyone who comes today to SD hospital and has become a suspected case, yet instead of we allowing the person to go and mingle with people in the community, we have a center that we can take care of and take the appropriate measures for that particular case to be handled by the appropriate authorities. So as institution, we have everything in place.
Okay, as an institution, they have everything in place. So the assurance is that if you go to SD hospital right now, those things are no more because we are not in the normal times. Sure. Yes, we are not in normal. It's said by the president himself. We are not in normal time. That's why you can see taxes have been reduced, electricity bill reduced, water free. So this is how it should tell you that we are not in the normal time. Yesterday, somebody was asking me that he never believed that Ghana, they can give water free of charge for 3 months. It has happened. Yes. So that tells you that we are not in the normal times. So wherever you are, please take your own destiny into your own hands and make sure that you have been guided by what the directive given by the health services. And then at least those of us who have privilege of having doctors as friends and those things, let's always consult them in case they're this. And secondly, we shouldn't be Minister of Communication or Minister of Information by announcing numbers on our radio stations.
Sure.
I know numbers, which is confirmed because the sources, but I'm not the right person to mention it. We wait for the afternoon when the appointed authority will do that. They will run our own commentary on that and whatever you want to say. Pastor, before I allow you to go and listen, you made mention of bringing things to the hospital.
Yes.
Let's dive. I know you're capable for the hospital, but as a man of God too, let's divert a little bit and let's look at our church members. What are we at the top there? What are they thinking about them? They're less privileged.
Yeah, thank you very much. It is a brilliant question. The church have put in so many measures in place to cater for those who are in need.
Okay.
But this has to do with the districts and the conference levels.
Okay.
Okay. For instance, in my church, I am a pastor for Beulah Church in Kumasi. Apart from my work, the work I'm doing, I'm still also pastoring. So our church members who are in need, we've taken care of them.
Okay.
We've given them food stuff and what they need to take care of themselves. Okay. And also in some places like in some conference districts in Kumasi, likewise they are also doing the same. And in Accra and other places, and some are doing it without announcing it. Which is not good. I don't want to be in this question. I won't come out telling you that this is what I've done for my church members. It is not good to do that. Okay. So the church, we've also invested a lot in our church members. We've taken good care of them and we are supporting. Although we can't provide everything, but at least we'll be able to meet you halfway to sustain the family so that at least you can survive. So the church, as a church, we've not neglected our people.
Okay, sir. Before I let you go, your final message for the people of Tamale.
Yes, thank you very much. My good brothers and sisters, Nananom, our leaders, thank you very much for your cooperation, for supporting the SDA Hospital. We thank you for the kind of trust and the confidence you have in us. And we, as at the secretariat level, we will also do our best to help to grow SDA Hospital in Tamale to become the citadel of medical excellence in the next few years. Thank you very much and God bless you.
God bless you too. And that is Pastor Dr. Amo Kyeremeh. Yes. Pastor no. In the pastor, ni jumedi obedi o Tamale nya say cases are we say it says the hospital one be abe twemu ho but nyame adom nipa kro no oja yaresa kama kan ho ye.
Let me put this on record. Around all the hospitals, we have 28 hospitals and clinics, 29 hospitals and clinics in Ghana. Now it is only Tamale where we've recorded first case. So we have to give them the needed support. Strengthening them to do the work, to save our people, my brothers and sisters, my family members, Ghanaians who are in Tamale here.
So for the record, SDA Hospital Tamale is the first, and then first to receive massive donation from them, because those things are the complaints. Some of the workers, if you go there to interact with them, they tell you.
Yes, and also as you said, when we heard of it, quickly we have to rush to come and see whether it is true or not. And the items we brought is over 20,000 Ghana cedis. And now that we've been able to ascertain the fact, in no time, you also come back to come and support.
Okay, God bless you, Pastor, for passing through. And then if you don't see you again and you are going back, safe journey back.
Thank you.
Okay, God bless you.